So my name is Ibrahim El-Daly. I'm a consultant orthopedic surgeon at King's College Hospital in London. I specialize in complex reconstruction of pelvic and acetabular fractures, as well as complex lower limb fractures, so breaks in the bones of the legs and other parts of the body. And I'm also a hip and knee replacement surgeon. So I decided to study medicine many years ago now because I was quite interested in sciences. I enjoyed particularly chemistry and biology and maths, and so I thought that medicine was an interesting, challenging topic to study. None of my members of my family are doctors. So I was the first doctor in the family. And I thoroughly enjoyed my time in medical school. I qualified from St George's University of London, and then I did my surgical training initially in the East of England Deanery, so that's in Cambridge area. And then I did my higher surgical training on the Royal London rotation, which is the biggest and busiest hospital in Europe. And that's where I trained to become an orthopedic surgeon. And then I went on to do my fellowship training abroad in Paris. And I'm now a consultant in King's. So I enjoyed orthopedic surgery because it's very rewarding. You get immediate results. So you have a patient who has a fracture, and you fix the patient, and they immediately recover from the break. Sorry. Similarly, if a patient has arthritis and you do an operation to replace their joint, they have immediate relief from their ailment. So I thoroughly enjoyed orthopedics as a specialty, and that's what made me decide to go into orthopedics, because of that sort of immediate sort of relief that the patient achieves from the interventions that we do. What I find most rewarding about my job is to see patients who have injuries or who have quite bad joint problems getting better. And it's almost a sort of a time-led journey. And what's nice is that you're part of that journey, and you're supporting them and you're guiding them throughout their journey until they get better. And so the most rewarding part of my job is to see that patient feeling great, feeling that they're back to normal again and they've got their life back again. I think patients value most about me is the time that I give to them in the consultation, particularly explaining to them exactly what's wrong with them, what treatment they need to go through, and sort of explaining to them in detail every point of their journey, so they can have a complete overview. And I try and keep things as simple as possible, and I explain to my patients. I think they value this quite a lot. They take away the message, and they thoroughly understand what the management plan is. So I think that's pretty much what patients value a lot in me. Obviously, the skill that I bring from the sort of my training and my background, I think that patients value my experience very much so.